Think Ozempic is the hottest drug right now? Think again. There's a secret trend nobody's talking about. Teenage boys and Silicon Valley tech bros are skipping doctors and injecting a mysterious liquid straight into their stomach fat. Why? For flawless skin, stronger bones, chiseled jaws. They're trying to hack evolution itself. Some call it magic juice, others Wolverine Peptide. Whatever the name, it's fueling a shadow economy most people don't even know exists. It's massive, it's underground, and it is just getting started. I'm Josh, and on today's episode of the Infographic Show, we're revealing why everyone is injecting magic juice. Chapter 1. The Cold War Blueprints. This all traces back to 1973, when the Soviet Union ran into a serious problem. Their soldiers were aging too fast. The condition was amplified in critical roles: submariners, missile operators, fighter pilots. The stress, the isolation, and a not insignificant amount of radiation all played a role. The men were breaking down at the height of the Cold War, and worn-out soldiers were a strategic liability. The USSR Ministry of Defense did what it always did. They brought in a military physician, Vladimir Khavinson, and years later he'd become Putin's personal anti-aging doctor. They gave him access to a secret lab in Leningrad, and they told him, "Fix it." Khavinson didn't find what they were looking for. He found something stranger. Your body is essentially a massive construction site operating in total darkness. No one can see the blueprints. No one knows what to build or when to stop. So your cells send tiny molecular text messages instead. Connect the amino acids and you get a peptide, a message delivered straight to the cellular workers, telling them exactly what to build, and when to stop. Some of those messages can even tell an aging cell to behave like a young one. That's what Khavinson found, and he spent the next 4 decades figuring out what to do with it. He published 775 scientific papers, filed 196 patents, treated cosmonauts, Chernobyl survivors, and submariners. He died in 2024 at the age of 77, largely unknown in the West. The Cold War had kept an iron curtain between his research and the scientists who might have replicated it. At the same time, the West was developing its own relationship with peptides, although it was much sweatier. In the 1990s, the bodybuilding community had figured out that they could manipulate growth hormone by using peptides to trigger the pituitary gland. Hulking athletes in gyms from Venice Beach to Eastern Europe realized they could message their own endocrine systems into producing more of everything. We call it biohacking. They called it getting jacked. The peer review process consisted of one guy in a gym telling another guy that it worked, and honestly, for their purposes, that was enough. Then, in the early 1990s, a Croatian researcher at the University of Zagreb, Predrag Sikiric, did something that would shake the biohacking world. He isolated a 15 amino acid chain from a protein in human gastric juice and discovered it did something no one expected. He called it Body Protection Compound 157, or BPC 157, and when he tested it on rats, it healed things: tendons, ligaments, gut tissue, muscle fiber. Not slowly, not partially, completely. BPC 157 seemed to work by turbocharging something called angiogenesis, or the growth of new blood vessels. This essentially rebuilt the entire blood supply to damaged tissue at a speed that had no clinical parallel or framework to explain. The biohacking world named it after the only cultural reference that came even close: Wolverine, the Marvel superhero who regenerates tissue, organs, and limbs in real time. And that name is what launched a billion-dollar underground industry. Chapter 2. The trillion-dollar demographics. On an online forum called looksmaxing.com, there's a thread titled, "Would you guys recommend peptides for someone 17?" One of the first replies is from a user with over 2,000 posts and 4,000 reputation points. His answer is telling: "I am 16 on peptides, and yes, I would." That is just the tip of the looks-maxing iceberg. It's a corner of the internet, mostly teenage boys obsessed with optimizing their appearance through every possible lever: jawline exercises, posture correction, skin routines, and increasingly peptide injections. And before you assume that this is just a fringe activity in a few bedrooms, New York and New Jersey have passed laws banning the sale of peptides and performance-enhancing compounds to minors. They did it because teens were already buying them freely at scale from vendors who asked 0 questions. But it isn't just teenagers. Recently, a patient walked into a Washington, D.C. doctor's office carrying a Trader Joe's fridge bag. When she pulled out a handful of syringes, her doctor assumed they were GLP-1s, Ozempic, Zepbound. They weren't. Her bag was full of something she called a Wolverine stack, a combination of peptides ordered online. They promised to heal her torn rotator cuff faster than physical therapy ever could. She spent, in her doctor's words, oodles of money on a 3-month supply and was injecting herself daily. "My trainer swears by it," she said. "Everyone's using them." A stack, by the way, is exactly what it sounds like, layering multiple peptides on top of each other, each one theoretically targeting a different biological system simultaneously. Think of it like a custom medicinal playlist, except every song is an unregulated injectable, and hitting shuffle could give you sepsis. The patient with the Trader Joe's bag is not an outlier. She is the demographic portrait of where this market has arrived. On July 4, 2025, podcast host Jaden Clark was at a party in the backyard of a San Francisco Victorian. Soon, an AI founder casually mentioned his Chinese peptide supplier. A crowd formed immediately. Everyone, it turned out, had a source. Clark posted about it on X. "Something I've learned is that the elites all have a Chinese peptide dealer." The post went viral and the term became a meme. And the meme was accurate. Gray market peptides have since flooded hacker houses, startup offices, and this is real, peptide raves sponsored by the suppliers. One recent event at Frontier Town in San Francisco featured a mix-your-own peptides workshop. A DJ played techno while chemistry structures projected in the background. The dress code called for crazy, futuristic cyberpunk attire. Attendees were shown how to draw their own blood. The FDA was not on the guest list. At a Manhattan biohacker meetup, one tech investor described the weekly scene with the kind of casual horror that only someone who's been doing it for 7 years could muster. Each week, someone will bring something new, and everyone will inject it. It looks like a bunch of heroin addicts. He said it as a joke. He's been microdosing peptides since 2018. The substances being injected at these gatherings read like a speculative biology syllabus. There's a copper-based peptide for skin regeneration, recently profiled in Vogue, BPC 157 for injury healing, ipamorelin and CJC 1295 for growth hormone release being used by teenagers whose brains aren't finished developing yet, epitalin for sleep, retatrutide still in phase 3 clinical trials for appetite, focus, and apparently everything else, and oxytocin, which an OpenAI researcher publicly called Ozempic for autism, being microdosed for social optimization. Silicon Valley engineers are injecting a compound just to make more eye contact. None of this is happening under medical supervision. It's happening on Reddit threads and Discord servers. YouTube influencers are holding up vials of clear liquid and saying, "I had tendinitis in my elbow. I started using BPC 157 and it was gone in 2 weeks." That last quote, by the way, is from Joe Rogan, verbatim. One San Francisco peptide supplier broke down the diffusion pattern with accidental poetry. It always starts with the CEOs, then CTOs, then COOs. Biopharma people are shockingly the most reserved. They're a little too deferential to the FDA. His average customer, he noted, is closer to a Starbucks barista. But the techies were first, he said, because of the willingness to take ridiculous risks. The anti-aging clinic industry commands an economy unto itself. Businesses charge $350 to $600 per peptide protocol per session. Gary Brecka, who calls himself the ultimate human, sells peptide injectables through his website and appeared on a podcast to evangelize the category to millions of listeners. Brecka's marketing is a masterclass in sounding scientific while saying nothing. Browse his site's approved and recommended $350 CJC 1295 and ipamorelin stack and click the Who's It For tab. You'll get individuals incorporating peptide support into structured recovery, training, or wellness protocols who want a synergistic dual peptide option that supports hormone signaling pathways and tissue maintenance. That is clear as mud and priced like crystal. If you want to watch people ignore common sense in the most creative ways, make sure to like, share, and subscribe. We got plenty more videos where we explain stuff people probably should not be doing. According to U.S. Customs data, imports of hormone and peptide compounds from China roughly doubled to $328 million in the first 3 quarters of 2025. That's up from $164 million the year before. But it is probably more. Nobody has a clean estimate of how much more is moving through misdeclared packages and domestic reshipping operations. The legal global peptide therapeutics market alone is projected to hit $294.6 billion by 2033. The gray market isn't a rounding error, it is its own industry, and it all runs through one country. Chapter 3: The Federal Paradox. This entire situation feels almost designed to produce the exact disaster it created. The FDA didn't ban peptides because people were dying. In late 2023, they quietly moved 19 popular peptides onto something called the Category 2 Bulk Drug Substances List. That effectively prohibited compounding pharmacies from preparing them. The stated rationale was that there was insufficient safety data, immunogenicity concerns, and manufacturing quality issues. All of which is true, and none of this explains why these specific peptides were singled out, especially when thousands of other compounds have equal or weaker evidence. For that explanation, you might have to follow the money. Getting a drug approved can range anywhere from tens of millions to several billion dollars in clinical trials. The only way to make that back is a patent. You get 20 years of exclusive sales while every competitor watches from the sidelines. That is the deal. That's always been the deal. Here's the problem though. These peptides weren't invented in a lab. They already exist inside of you. BPC 157 is a direct fragment of a healing protein that lives in your stomach right now. TB 500 mimics something that your immune system produces every time you get hurt. You cannot patent something your own body makes, so nobody funds the trials. The FDA never gets the evidence it needs to approve them, and these compounds get stuck in a kind of permanent legal purgatory. They're available to anyone with a credit card and a browser, but impossible for any licensed doctor to prescribe or any licensed pharmacy to fill. A law-abiding citizen actually has fewer legitimate options here than someone willing to buy from a stranger online. In 2023, the FDA took this already broken situation and made it worse. They banned compounding pharmacies, the one legitimate middle ground that actually functioned. These were the licensed facilities where physicians could order peptides for specific patients with quality controls, sterility testing, and real medical oversight. The kind of infrastructure you would want between a patient and an experimental injectable compound. Gone. Banned overnight. Did people stop using the peptides? No. Demand just picked up and relocated straight to WhatsApp, factories in Guangdong province, and the veins of the people who now had no other option. Chapter 4. The Chinese Shadow Market. Dr. Paul Abramson, a concierge physician in San Francisco, has watched peptide use explode among his young tech patients. He described the procurement process this way. It's not like funding a scrappy startup, it's wiring money to an unregistered offshore entity based on a pitch deck. Here is the pitch deck. A vial of BPC 157 begins its journey on the Chinese social media platform known as Red Note. The sellers operate with a confidence that makes it seem like they have never once worried about the consequences. One undercover journalist found a seller whose account showed refrigerators full of color-coded peptide vials. The moment contact was made, the conversation moved straight to WhatsApp. 10 vials minimum order, $60 shipping. About $48 total for 10 vials of tirzepatide, the active ingredient in Zepbound, which Eli Lilly sells to American patients for $399 a month. The markup between Chinese factories and U.S. pharmacies is roughly 800%. Someone is making an extraordinary amount of money in that gap, and it's not the person doing the injecting. The legal fiction holding the whole operation together is 3 words: research use only. Under U.S. federal law, selling BPC 157 is technically legal as long as it's marketed for laboratory research. So every vendor website is wallpapered in disclaimers. Not for human use, for research purposes only. Not intended to diagnose, treat, cure, or prevent any disease. It is a legal pinky swear. A liability shield that transforms 100% of the risk to the buyer. Both parties understand exactly what's happening. When a journalist asked a Chinese factory operator directly whether they knew their Western customers were injecting these products, the operator didn't hesitate. Yes, that was it. That was the whole answer. Customs is where things get creative. Shipments arrive hidden in cosmetics packaging, labeled vaguely enough to pass inspection, or they're bulk shipped to U.S. addresses where individual USPS labels are added before delivery. It's a domestic reshipping operation that keeps the international leg of the journey invisible to inspectors. Customs and Border Protection has been aware of this system for years. Their enforcement record on personal quality peptide imports is essentially non-existent. So no, the risk here is not arrest. The risk is considerably more personal than that. The risk is opening a package from Guangdong and discovering the hard way that what was inside is not what you ordered. Chapter 5. The Vigilante Testers. The gray market quality problem is far worse than most users realize, and most users already know it's bad. Multiple studies have found that between 20 to 60% of gray market peptides contained incorrect amino acid sequences. That means nearly half of what people inject isn't even the intended compound. It's just something else in a vial with a convincing label. On top of that, a significant portion of tested samples exceeded safety thresholds for endotoxin contamination, meaning bacterial byproducts that when injected trigger systemic inflation or, in serious cases, septic shock. Traces of heavy metals, lead, arsenic, and mercury are showing up as leftover byproducts in these compounds that people are injecting directly into their bloodstream. Technically, two things can be true. Your vial might test as chemically 99% pure with a correct molecule and concentration, but it can still be a tiny biological soup kitchen for things that want to kill you. So the biohacking community did what any reasonable group would do when faced with a completely unregulated injectable market. They formed a committee. They crowdfunded money to send batches to independent labs. Janosik in the Czech Republic and Finric in Texas, which specialize in testing gray market compounds. Results get posted publicly in forums and Discord servers. Vendors who pass get recommended. Vendors who fail get dragged. It is a fully functioning consumer protection apparatus for an entirely illegal market built by amateurs on the internet in their spare time. The problem is that certificates of analysis are trivially easy to Photoshop. Vendors can pass legitimate tests on one batch and then quietly ship off a completely different one. Even a genuine freshly issued certificate tells you nothing about sterility, nothing about endotoxin levels, and nothing about whether the compound was stored correctly. That is critical for peptides, which degrade quickly when exposed to heat or light, especially during a 2-week journey from China in the back of a cargo container. Which brings us to Brooke Bowman. Brooke is 38. She's the CEO of Vibe Camp, an annual gathering of the rationalist community, and she did everything right. Everything the community considers responsible anyway. She logged every injection in the Peptide Tracker app. She monitored her sleep and her heart rate obsessively. She got regular blood work. She started on BPC 157 and TB 500 for chronic fatigue, and then added retatrutide for theoretical cognitive benefits and to help her quit vaping. She was, by the standards of this particular subculture, a model citizen. One day, she accidentally doubled her dose. Her hair started falling out within a month. Her resting heart rate jumped 10 beats per minute. She says she plans to keep going. She also mentioned that she got clean from heroin in 2020. Peptides scratch a similar itch. "I'm not getting that from heroin anymore," she said, "so it's fun to have a new thing I'm experimenting with that isn't horrible." Another shipment from China was already on its way. Chapter 6. The Cancer Paradox. There is something else the forums don't talk about much. The reason people use BPC 157 and TB 500 is the exact same reason doctors lose sleep over them. Both compounds work, if they work at all in humans, by promoting something called angiogenesis, the growth of new blood vessels. This is the mechanism behind every headline claim that you've seen. Healed my tendon in 2 weeks. Fixed my gut. Shoulder injury. Gone. Angiogenesis works by rebuilding damaged tissues. It restores blood supply to an area, essentially regrowing the infrastructure that the body needs to repair itself. That sounds great. But angiogenesis is also how tumors grow. Cancer cells are not magic, they need oxygen, they need nutrients, they get both of them through blood vessels, just like everything else in your body. And one of the first things a tumor does when it starts to grow is send out chemical distress signals to recruit new blood vessels. This process is called tumor angiogenesis. It's so fundamental to how cancer spreads that an entire generation of oncology drugs was developed for the sole purpose of blocking it. People are injecting a compound specifically designed to accelerate the growth of new blood vessels throughout their body. If those blood vessels are feeding a healing tendon, great. If those compounds reach a cluster of precancerous cells, they might have poured gasoline on something that was quietly going nowhere. This is not a confirmed finding, nobody has done the study, and that's because the compounds aren't approved and the trials simply don't exist. But it's a scientifically valid concern raised repeatedly by researchers with nothing to gain. It's exactly the kind of warning that gets lost in the noise of a forum full of people who feel absolutely fantastic. Dr. Eric Topol, director of the Scripps Research Translational Institute, went on record to call the entire peptide craze unfounded. Of 36 published studies on BPC 157 through 2024, 35 were conducted on animals. The vast majority of all global BPC 157 research comes from a single lab, the same lab in Croatia where it was discovered. A human clinical trial began in 2015. It was quietly canceled in 2016. The results were never published. No explanation was given. Nobody followed up. That is the entire evidence base for something millions of people are injecting into themselves before breakfast. So basically, magic juice users are effectively gambling the house on an experiment where they are both the subject and the control group, and nobody is taking notes. Chapter 7: The RFK Jr. Disruption and the Pharma Trap. On February 27, 2026, Robert F. Kennedy Jr. appeared on the Joe Rogan Experience and announced that 14 of the 19 peptides the FDA banned in 2023 were about to be unbanned, moved from Category 2 back to Category 1. Compounding pharmacies would be able to make them again under physician prescription within weeks. The biohacking community lost its mind. Every forum, every surfer that had spent years crowdfunding lab tests and swapping Chinese supplier tips were taking the digital equivalent of a victory lap. RFK himself called the original ban illegal and said it had created a gray market it was supposedly trying to prevent. He's not wrong about that. After 2023, the gray market metastasized. The number of people injecting unregulated, unsterile compounds from overseas went up dramatically. Rather than stopping peptide use, the ban just pushed it underground. The FDA had essentially performed surgery to remove a splinter and accidentally hit an artery. So yes, the reversal is a win. In one specific, narrow sense, it genuinely is. But there are still no clinical trials, still no safety data on what a decade of use looks like, still no answer to the cancer question. And while the biohacking community is celebrating the open door, the pharmaceutical industry is quietly buying everything up. The legitimate peptide therapeutics market is projected to double within a decade. Pharmaceutical companies are closing deals worth hundreds of millions of dollars. These are the kind of numbers companies commit to when they're certain something works and they're racing to own it before anyone else does. The natural molecule can't be patented, we've established that. But tweak a few amino acids, file a new formulation claim, and suddenly it's $400 a month for 20 years with a prescription your insurance might not even cover. Suddenly, the gray market loophole closes the moment your approved version clears the FDA. Now there's a legal alternative. The research use only fiction becomes a lot harder to maintain. Anyone who wants the compound goes through the healthcare system. That same healthcare system that these companies already control. It's the oldest move in the pharmaceutical playbook. It has worked every single time it's ever been run. Millions have been testing these compounds on themselves. They've been generating real-world data that clinical trials are supposed to produce. The people who benefit the most from RFK's announcement are not the teenagers in Ohio, the Silicon Valley types, or even Brooke Bowman waiting on her next shipment. They are the big pharma companies standing to make millions. The underground was the trials all along, and the pharmaceutical industry got its results for free. Peptides are part of the story where people are at least trying to heal themselves. If you want to see what the other end of America's unregulated drug hellscape looks like, check out The Only Drug You Can't Survive, or click on this video instead.